We are live on Facebook. It will be streaming in the Department of Maxillofacial Surgery group, and we can take in many people also over here. Not a problem. So we have actually our colleagues from the medical as well as the physiotherapy college. Thank you so much for joining. Apart from the dental college staff members and postgraduates. So we'll be starting shortly. I think in just a couple of minutes. So Deepika, we are all set?
All set, sir.
Yeah, okay. So just 1 minute actually before we go live. I mean, we are live before we start the program. So in the next 1 hour, we'll have Dr. Anshu. It's her name is small, and so there is no surname also. So that helps you a lot, Anshu, doesn't it?
I don't know. I get into trouble, but once I have my passport without a surname, it works. Otherwise, I had lots of trouble in Maharashtra with you need a father's name and a surname.
So because I have a problem getting my name in the name field of any form.
Right.
S. Ramakrishna Shinoy takes a lot of space. So I mean it's wonderful that you have such a small and charming name.
Thank you.
Okay, so we'll go live and welcome, ladies and gentlemen. It's with great pleasure that I invite you all for this program, Fostering Professionalism Among Healthcare Professionals. This is being organized by the PG Cell and the NAC Cell. And we have a very renowned speaker, Dr. Anshu, will be introduced in detail by by the moderator of the session. This was the need of the hour to have such a program, and I'm sure Anshu is going to keep it very interesting for the next 1 hour. And from the discussion that I had with her, that we are going to have a break where she's going to interact with the audience. So I won't take much time. I will introduce our moderator for today, Dr. Deepika. Dr. Deepika Chandok is a gold medalist in conservative dentistry and endodontics and is an associate professor and PG guide at VSPM Dental College, Nagpur. She has authored a book on conservative dentistry basics, and she is also the reviewer of the latest edition of the book Grossman's Endodontic Practice. She's got numerous accolades in academic, social, and creative genres. She is an entrepreneur and the director of Studental, which is an online teaching leading learning portal with more than 85 mentors across India and abroad. She runs an NGO, Swasthya Vriksha Foundation, of which she is the founder president. She's a very multifaceted person. She is also the president of 2021 for the very well-known doctors JCI Nagpur Medico. And through this organization, she has conducted numerous empowerment and social programs which have received national recognition. Dr. Deepika, the stage is yours. Please introduce our speaker for today.
Thank you so much, Rama sir, for the privilege. A very good morning to one and all. It's not what job you do, it's how you do the job, isn't it? So professionalism is an integral part of our professional lives today. And to speak on this topic, we have an eminent and dynamic speaker, Dr. Anshu ma'am. We welcome you, dear ma'am. Dr. Anshu ma'am is the professor of pathology at Mahatma Gandhi Institute of Medical Sciences, Sevagram. She's a faculty member and resource person at 4 Indian FAMER regional institutes: CMCL FAMER Ludhiana, CSMC FAMER Mumbai, PSG FAMER Coimbatore, and MAHE FAMER Manipal. Ma'am, I hope I have pronounced them correctly. She was invited as a global faculty for the FAMER Institute at Philadelphia in 2011 and 2012. She has written 3 WFME FAMER distance learning modules for the Center for Medical Education and Context, UK. She has edited a book also along with Dr. Tejinder Singh which is titled Principles of Assessment in Medical Education, which is going into its second edition soon. So congratulations for that, ma'am. She was a secretary of Academy of Health Profession Educators from 2017 to 2019. Dr. Anshu ma'am, on behalf of VSPM Dental College and Research Center, I welcome you once again. And it's a privilege to have you with us today. Now I request you to please start the presentation for which we all have been waiting for. The screen is all yours, ma'am. Thank you.
Thank you, Dr. Deepika. And good morning, everybody. At the outset, I'd like to thank Dr. Shinoy for inviting me to give this talk. Coming to my talk, today the topic of professionalism is more relevant than before. There was a time when patients would give you complete control over their lives, and a doctor had the complete autonomy to do what he thought was right. However, today the concept of professionalism has evolved to something completely different now. The earlier approach, if you use it today, would be considered very paternalistic. Patients are now more aware of their rights, they have access to different sources of information, and their expectations from health professionals has changed. Unfortunately, in this process, the trust that people had with healthcare providers has eroded considerably. And as healthcare professionals, our own attitudes towards our vocation has changed. So if you think back, and I'd like you to reflect on why are we in the profession? What do we get out of it? And what are we expected to give back to this profession? As I will go through this session, I would like you all to reflect on each of your life journeys. If you think back to the time when you were a student and now when you are an experienced professional, and try and think about those stories which were life changing, which taught you that this is a profession which is very different from any other profession which your friends would have chosen after school, and why, despite being in such a profession, you also can make mistakes. I'm sure everybody has made mistakes, and what helped you, what you learned out of it. And if you start reflecting on those, you will find this session a little more useful. So the basic session objectives is that, because this is an initial session, I'm not going to go into very broad details, but I will give you an overview about what are the different components included in the multi-competency of professionalism. Professionalism is a core competency which every healthcare professional should have, but it has many different components. So I call it a multi-competency. And why do people not behave professionally? What are the reasons, the common reasons for lapses in professional behavior? And then we will briefly go into what are the ways of teaching and assessing professionalism in the training environment. So first, let me put you in a situation. Suppose you are in a new city, and unfortunately, you have to be rushed to the hospital because you have an accident or some such thing where there is an emergency. Now, you are in a new city, sometimes maybe a new country, you know nothing about the hospital or its staff. Now, I'd like you to think about, what would your expectations be? What attributes would you be looking for in its healthcare providers? You could use the chat function if it's there, and Dr. Deepika will read them out to me. So what are the attributes that you will be looking for in a healthcare provider in a hospital? Suppose you were a patient and you didn't know anybody, it wasn't your own hospital.
Anshu,
Yes.
yeah, sorry. The issue is that they'll have to raise their hands.
Okay. So you can
Because
raise
the
your
chat,
hands and
or maybe what I can do is let them put it in the chat box.
okay.
I will see it myself, or
Okay.
they can put it to Dr. Deepika, who's the co-host of the meeting.
Right.
So these are because of the privacy settings that has happened.
Sure.
Whatever chat you have, you can put it either to me or to Dr. Deepika. So right now
What?
we don't have any. Okay, yeah,
Yes,
Tapasya.
go ahead.
Yeah, Tapasya has said she's given an answer: quick management of emergency and empathy.
Right. So you're looking at two different aspects. You're looking one at the heart and one at the head. So you're looking at somebody who has empathy for you, somebody who's compassionate, and then you're looking for somebody who's competent enough or who's quick, who knows what he's doing, he or she is doing. Any other responses?
None yet.
There's no point in my speaking and not people not interacting. So I'm going to wait. One or two more responses?
I wouldn't disagree with what Dr. Tapasya has said.
Yes.
I would be looking at immediate attendance of my problem. That would be one. Tapasya is saying transparency of investigation.
Okay. So yes, whatever they are doing, you ought to be told about what is happening. Where are you? Are you okay? Are you not okay? So that kind of communication has to be there. Agree with it. Anything else?
No, not right. Yeah, Dr. Manisha Deshpande from
Yes.
physiotherapy, she's saying immediate attention. Dr. Pratima Shenoy would be looking at empathy factor. Swapnil Patil says prompt treatment.
Right. So everybody is looking at being taken care of immediately, and somebody who actually feels like somebody of my own, mera koi apna wahan ho, because I am alone there and I don't know anybody. And if the doctor or if the healthcare provider feels like they care for me and they are not very distant from me or indifferent to me, I will feel comfortable.
Yeah. So just for the benefit of all our viewers, that whatever questions or suggestions you have, you can please pose them to Dr. Deepika. She is the moderator, so she'll read it out to Dr. Anshu, right? Vandana Kokne madam says display of information, the directions as to what has to be done. Dr. Shubhangi says hassle-free procedures. So these are a few responses that you got.
Right. So I think you have responded and got out a lot of points. Now, when you say that this is what you're looking for in a healthcare provider, be certain that these are qualities that patients are going to be looking for when they say who is a good healthcare provider. This is what they're going to be looking for. So I'd like to take you to this quotation by William Osler, who said that the practice of medicine, and I'll say any healthcare profession in this context, is not a business, and it can never be one. Our fellow creatures cannot be dealt with as a man deals with corn and coal. The human heart by which we live must control our professional relationships. So, what you need to know here is we have chosen to be in a profession here where we are dealing with human lives, human emotions, and we cannot be compared to any other profession uh, which deals with selling or buying of things. Unfortunately, some parts of medicine have become like that, and we cannot lose the essence of our profession, which is very different and much higher than what other people are doing. So I'd like you to answer the next question, which is, what do you understand by professionalism? So when I use the word professionalism, you can raise your hand and one or two of you can unmute yourselves and answer. So what do you understand by professionalism? Or if you're not comfortable doing that, please use the chat box.
Ma'am, Dr. Aditi Fadnavis says proper attention should be given. This is what she messaged me.
In response to the previous question, yeah.
Yes.
So my next question here is, what do you understand by professionalism? We all use the word professionalism every day, that this person is professional and not professional. But what do you understand by it?
Professionalism is the way you conduct yourself.
Okay, that's one response.
Yeah. And
ma'am, I also feel professionalism is how you do your job.
Okay, how you conduct yourself, how you do your job.
I've got some responses. Dr. Apurva says responsible behavior. And Dr. Manisha Deshpande writes, through thorough knowledge of the subject, empathy and mannerisms.
There are three things she's talking about. She's talking about knowledge. She's talking
Correct.
about what did she
Empathy.
say? Empathy, which is
yes.
again how you behave there, and also the last
Mannerisms.
one, mannerism. So your bedside behavior, or how you talk to patients, how you behave with patients, or how you behave with anybody for that matter. All of them do come into professionalism. Any other
Correct.
responses?
Dr. Rashmi Ronge says, know your art to diagnose and treat treat the patient is benefited saving time. I'm not getting this actually.
Right.
Know your art of diagnosis and treatment. I think
so it's not enough to be nice to the patient. You have to know your job as well. So
Yeah,
it's both components are equally important.
What she's saying is patient value for time and money. That is
right. So you have to value that the patient has come to you, not exploit the patient when it comes to charging or whatever, but take your services. That is quite sure. And then value that the person's time is being spent. So do whatever you can as quickly as possible.
Absolutely. We have Dr. Swapnil Patil saying it's a manner by which professionals work. While Dr. Trupti Chordia says your attitude towards work, right attitude towards colleagues and work.
Right. So there are, now, as you can see from your own responses, there are a number of different components which are coming up. And still, I wouldn't say that any one of you have defined professionalism perfectly, because each of you have talked about different components. So the problem with professionalism is like saying, what is obscenity? Everybody says, I don't know what, I cannot define what obscenity is, but if I see obscenity, I know it is obscene. The similar thing works with professionalism. When something is unprofessional, you know it's unprofessional. But when I ask you to define something, it's going to be difficult, because most of these values that you talk about are lofty ideals, which you know ought to be there. But when you tell them to observe it or measure it, it's very difficult to do that, because they are not things which you can quantify, right? So
rightly said. Ma'am, I have one more response. Can I just read that?
Yes, go ahead.
Yeah, Dr. Siddhant Hevle, following the right protocols which would benefit the patient is what he says.
Right. So it's much more than protocols is what you have seen here, right?
Absolutely.
So there are a number of definitions of professionalism. There are hundreds and thousands, and each one, as the time has changed, definitions have changed. In the beginning, there used to be a different definition where it used to talk about autonomy, a doctor's autonomy to do things for the benefit of the patients. That has completely changed now. And the definition which is accepted here is, this is one of them, is by Arnold and Stern in their book, Measuring Medical Professionalism, which says professionalism is demonstrated through a foundation of clinical competence, communication skills, and ethical and legal understanding, upon which is built the aspiration to and wise application of the principles of professionalism, which are excellence, humanism, accountability, and altruism. This looks difficult, but I think it'll be made more easy if I show you this picture, which is the exact same definition of what I said. So if this is the framework for professionalism, the foundation is laid by clinical competence or your knowledge. But not merely having clinical competence or knowledge of medicine is not enough. You need to have good communication skills, an understanding of what the ethics and the legal aspects of your profession are. So the strong base will be formed by these three: clinical competence, communication skills, ethics, and legal understanding. And you then have the pillars, the 4 pillars called excellence, humanism, accountability, and altruism, which are all aspirational. These, if you ask me to tell you what, if we ask you what excellence is, or what humanism is, or what altruism is, you'll find it very difficult to say whether I'm altruistic or humanistic or whatever. But these are the pillars on which the capstone of professionalism is laid down. So you need all of this to form professionalism. I'll take a moment to explain these 4 terms which come under professionalism. The first is excellence. Excellence includes a number of things. It is a lifelong commitment. It's a commitment to competence in technical knowledge and skills. you need to understand your ethical principles and values. You have to have a knowledge of legal boundaries and communication skills. But I like to emphasize this word lifelong learning because it's a continual, conscientious effort to exceed ordinary standards, to strive to be extraordinary. So it's a life's philosophy, and you need to have that in you, that drive in you, to always try and be better than you already are. This is important for continuous improvement of the quality of care. If each one of us think that let me be the best version of myself and let me try to be better than what I am today, this is striving for excellence. The second pillar is humanism. Now, these are a group of traits which are very difficult to define. It says that you have to be caring and compassionate. Compassionate is that you need to feel the pain that, or you need to feel um, sort of your heart must melt when somebody else is suffering. You must be moved by it. Empathy, what is empathy? Empathy is the ability to stand in somebody else's shoes, to actually feel their pain. And then there has to be honor and integrity. It's what you say that ek bar commitment kar di to, you'll have to stick by that commitment. So you are a person of your word, and when you make a commitment, you stand by it. Respect is that you give regard to everybody else's dignity, whether it is somebody superior, somebody of your level, or a subordinate. And this means respect for people of all communities, irrespective of their socioeconomic status, respect for all ages, for all genders, of people with disabilities. It encompasses all of these together. So these are features that we are looking for when we say humanism. One feature is accountability. Accountability is one of the most important features here because you need to take a responsibility for your activities. You have a responsibility towards patients, families, and society. And the elements which come in here are self-regulation. You need to know whether you're competent enough and then whether you have some weaknesses for which you need to train yourself in. Standard setting, you compare to the rest of your peers. Where are you standing? Where are your weaknesses? Where do you need to improve? These are things that nobody else will tell you. You need to know and keep improving yourself. And then you have to have conflicts of interest, duty, and then you have to know how to manage conflicts of interest, duty, and responsibility. If you look at the present COVID scenario, you have had people of all walks of life who have actually come out of their comfort zones and actually contributed. Doctors, healthcare providers, even the cleaning staff, everybody have taken it up as their responsibility, their accountability to work in a COVID situation, even when their own lives are at threat. So this is the kind of commitment or responsibility that we are looking for when we talk about professionalism. And the last pillar is altruism. Altruism is putting the best interests of your patient before your self-interest. One example that I'd like to give you is when you had the Mumbai attacks, the 26/11 attacks. If you remember the story of the Taj Hotel staff there, their lives were at risk, but they went out of the way to take care of all the guests who were affected by the terrorists there. So that is altruism, where you put your own self-interest um, uh, and that at the and you let it take a back seat, and the best interests of the patients come in front. So this is all components which are blurred. There are no strict boundaries. If you ask me what is the difference between ethics and professionalism, it's a very blurred boundary. They have both these elements in both the components. So you cannot have a clear cut watertight compartment saying this is ethics and this is professionalism. They all blend into each other. Having said that, I'd like to define some of the core attributes of professionalism, and just to make those terms very clear. One is competence. Now, when you say competence, you're talking about your mastery and how you keep yourself updated in your knowledge and skills relevant to your practice. Commitment, as I said, is being obligated or emotionally impelled to act in the best interest of the patient. and we've all taken the Hippocratic Oath or its equivalent. Uh, Integrity and honesty, we've talked about already, a firm adherence to a moral code of values. It comes from your value system, what you've learned at home, that you cannot be corrupted by anything, whether it is power, whether it is money, whether it's any other kind of bribe that you get. Morality and ethics, where you act for the public good, conform to the ideals of the right human conduct in dealing with patients, colleagues, and society. Altruism, we've already discussed. Autonomy is the doctor's freedom to make independent decisions in the best interest of the patient or for the good of society. This is something which used to be one of the top features of professionalism, but now the concept of informed consent and how much transparency and how much you communicate to the patients have become more important. And autonomy, if you do it autonomously, if you do something without telling the patient, you might be in trouble. So this is the meaning of autonomy has changed over the years. Self-regulation, we've already talked about, how you maintain your own standards, how you're accountable for your own actions and conduct, and how your conduct affects the professional. I would say that most of us, if you ask us, are you professional? You will say yes. There is a very small minority of people who do not behave professionally, and unfortunately, a few black sheep are always highlighted. So it's the media which sensationalizes one or two bad episodes, and then the entire profession gets a bad name. So whatever you do, be very aware that what you are doing is bringing a bad name or a good name to the entire profession, because it's not you who's being affected. There are a number of others who are going to be affected uh, by your actions. We know about responsibility to society, how you're going to use your expertise to be accountable to society for both the personal good of the patient and for the profession. Responsibility to the profession, we've already talked about. And one thing I cannot emphasize enough is teamwork. It's important to respect the expertise of others and work together. Quite often you see people saying, I am professional, I don't care what the other people think. It's not true. You are working, every healthcare profession cannot survive without teamwork. When you see another colleague being affected um, by stress, by something which is causing him to be unprofessional, maybe it is the increased workload, maybe it is the misbehavior of another one, it's important that you stand up and speak for that person, because tomorrow you might be in the same situation and then nobody will speak for you. So if the profession has to survive, we have to be in a team, we have to support each other, and also point out where professionalism is not happening and how corrective action can be taken. So here I'd like to stop and I would like to hear from you and tell me some stories. So what I'd like to tell you is that in the past few months, we have all been affected by, in one way or another, by COVID. So I want you to think of an anecdote, either as a healthcare provider or as maybe you were affected by COVID and you were the patient, or maybe a family member was affected and you were the caregiver. And during your interactions with healthcare provider, can you think of some anecdotes which highlighted good professional behavior or bad professional behavior? I'd like to hear one or two stories. So raise your hand, and I think Deepika will unmute you. So your experiences with professionalism in the last few months.
All the participants are unmuted. You can unmute your own device and please speak up. Please share your stories with ma'am.
Let's go one by one. So anybody will need to go? Raise your hand and Deepika will tell you.
Anshu, by and large, we as a country need to really pump up our professionalism. That's where we lack. I mean, I'll give you a simple example. It may not be pertaining to the pandemic period or whatever.
Okay, go ahead.
Let's say I want to speak to a particular head of the department. Okay, and the peon or the clerk picks up the phone, right? You don't have those many courtesies, to say that, sir, मैं एक minute बुला के लाता हूँ, sir, yeah, whatever. It doesn't. I'm not asking to be addressed as sir or whatever. But they'll just keep the phone down and then fetch the other person. So this is, it could be anyone. It could be not just a peon. It could be anyone. So we actually need to hone up our professionalism in so many ways. The way we answer calls, the way we carry out things. I mean, this is just a microcosm of what I'm saying. It may or may not be true for everyone, but this is what I experience. I mean, maybe we also, being in educational institutes, are we really up to the mark in dealing with the patients? That's also something, because we feel that teaching institute hai, patient to aayega hi. So it's not something like that. We need to sharpen our professional skills in so many ways.
Right. So it's not just in how you deal with patients, it's how you deal with colleagues, it's how you deal with students, how you deal with your own subordinates, how you speak to them, whether you respect them in your daily work. Are your subordinates being treated in a dignified manner? So these are questions you need to ask. And there are a number of things that I think come with practice. And unless somebody points it out to you sometimes that this behavior is not acceptable, maybe you can be a better person by being a little more polite. And I've seen doctors, I've seen healthcare professionals. If you have a paid patient coming in, you behave differently. If it's a less person who's of a lesser socioeconomic behavior status, you have a completely different behavior. And as students, we tend to notice how our teachers are behaving. So those are things that you need to ask yourself of whether what you're doing is right. It's everyday thing, how you behave when you're not being observed. So
it's something, it's like a confession that I need to make publicly.
yes,
I was not professional enough in sending you the link the day before.
no, it's like you yeah, I mean, there are lots of emails lying unanswered from my side also. So there are things that you need to control and see what is, prioritize all of that.
Yes.
Yeah.
True,
Any other
true.
stories?
I think, ma'am, a lot of our PG students have gone for the COVID duty. If any
Yeah.
PG student would like to share their story, please unmute and talk. PG students, we would like to hear from you.
I think they would be worried about speaking out their heart right now.
No, I think this is the right place to talk. Nobody is listening. You can talk.
Yeah.
And if you want to get the message across to your dean, it's a better place to talk. Because I'm sure all of us have gone through such experiences.
Very true, ma'am.
I mean, you cannot forget.
Anybody?
You cannot forget a time when you yourself have behaved unprofessionally. You cannot behave a time. You cannot forget a time when somebody has behaved unprofessionally with you. So, any stories? I remember reading the story about an anesthetist who was admitted for COVID, and there's somebody else who required intubation on the next bed, and because the doctors couldn't reach in time because they had to wear a PPE and then come in, he forgot about his own breathlessness and got up and intubated the other person. That's kind of commitment we're looking for. And it is times of crisis. Yeah.
Sanket Mehta, if I'm not
Ma'am, network connection नहीं आ रहा मेरा अच्छा.
We can hear you.
Well, if we could hear you speak that, you have the network connection. Anshu, that was Sanket Mehta from Surat.
Yes, Surat. People have joined from Surat. Good.
Yeah.
Anyone else? It's no fun just me talking. I want more stories coming in. So, what do you consider professionalism? If a medical student or a undergraduate student or a PG student is cheating in the exam, is that professional? If you as a student are copying in the exam, is that professional? And if you see another student copying, should you report that student or not for unprofessional behavior?
I think I have a story about my own PG student, which I would like to highlight in a
Yes.
sense that he himself had COVID. His parents both had COVID and he was under quarantine also. But then, when the COVID duties were announced, he was the first person to say that I'll go for the duty. And when he went there for the duties, so when they were allotting the duty, the one thing which he said is that I want to do duty where there are maximum number of patients and where it is more like people are not wanting to go. Wish to go there and serve people. So he's a student, Dr. Sangam Madakavde, and it really touched my heart when he said those words. So I think that
So I think it is times of crisis which brings out this extraordinary courage and the ability to go beyond your call of service and do it. So we look at people like that and get inspired. So not all stories are black or negative. You have all kinds of stories.
Yeah.
So, and I'm sure you all have your share of unprofessional stories as well.
Yeah, after being in a profession for more than 25-30 years, here is a fresh postgraduate who's teaching you a lesson in life.
Right.
So I
That's
think
good.
that is also very important, to be very open to what you can learn and get inspired from others.
Thank you, Dr. Pratima. That's interesting. Very, very nice.
Thank you.
Any other stories?
Dr.
Yeah.
Anshu ma'am, so I have this second year PG with me, Dr. Ankita. She's
Yeah.
right here. She would like to share her experience on that.
Right.
Good morning, ma'am.
Good morning.
Good morning, ma'am. Good morning, sir. Ma'am, sir, there was an incident happened with me. एक बार एक पेशेंट आए थे जिनका हम RT-PCR करते हैं, तो वहाँ पे हमें फोन नंबर देना होता है सो दैट कि उनका जो रिजल्ट होता है वो उनके फोन पे जाता मैसेज होता है. तो उनका फोन नंबर रॉन्ग हो गया था सिस्टर के हाथों से, तो उन्हें सेकेंड डे ही फ्लाइट से ट्रेवल करना था. तो दैट टाइम उन्हें मैसेज नहीं जाता और वो वहाँ पे हार्ड कॉपी लेने भी नहीं आ पा रहे थे. तो हम लोगों ने वहाँ पे उनका जो रिजल्ट था वो जहाँ से आता है लैब से, हम लोगों ने वो रिजल्ट मंगवाया और उन्हें फिर प्रॉपरली मैसेज किया उनके जाने से पहले. तो वो जब एयरपोर्ट पहुंचे थे तो उससे पहले ही उनका काम हो गया और उन्हें यहाँ तक फिर से कोई इश्यूज नहीं हुए. तो आई गेस कि हमें पेशेंट्स या फिर जो भी है उनकी केयर करना भी एक प्रोफेशनलिज्म ही हो सकता है, ऐसा I feel.
Thank you, Ankita. And it's a lot of time when you say that this is not our problem, but you always, if you know the backstory, if you know what is happening, then probably the human in you is awakened, and then you actually go ahead and go beyond what is your written responsibility, so to say.
Absolutely, ma'am.
Any other stories, or should I go ahead?
Yeah, I would like to share my experience.
Yes. Can you name yourself? I can't
Yeah. I am Dr. Manisha Deshpande.
Yes, Dr. Manisha.
This is regarding my daughter's experience. And my daughter was, she is working in Sion Hospital in cardiology. But she also had to do the COVID duty. And when she was in the COVID ICU, what she had realized that like the media was giving very bad propaganda that doctors are not working, healthcare workers are not doing their proper job. And she had a different experience, like when the patient was admitted and if some death has happened, even the relatives were not willing to take the bodies. That is what her experience was. And many times, like she has given money to the relatives, the old spouse of the deceased person, to carry the body to the crematorium and the ambulance charges. Like she and her colleagues, they have contributed for so many patients. So these things never come up. So this is the like professionalism along with the empathy shown by the PG students.
Right.
To people, those who are not known to them.
Yes, this is the pandemic has really brought out so many different facets, and people have risen to the occasion. And I was seeing stories about how the autopsy staff at the hospitals has been working without going home, and it's touching to see the kind of
that was a really touching story. Manisha ma'am is the Dean for Physiotherapy College,
Thank you, Dr. Manisha.
NKP. Yeah.
So I think I'll go ahead, otherwise we don't have too much time then. So we've talked about different stories, and why do we need to be professional? One is, yes, for a lot of us, the trust of the public has eroded, and this is a time when we need to rise up and come back, to rise in their eyes again. Um, this altered perception of the public, thanks to the media sensationalizing all the wrong things, needs to come back. And we need to talk about also in terms of our training. Our training, both in terms of selection, the amount of capitation fees that people have to pay, and if at the end of paying through their nose to get admission into colleges, will students behave responsibility after that, or is their prime motive earning back that money? So you will have to think about these things as well. What is important is that to realize that everything which goes wrong, it's usually a medical error, or maybe a person dying because he was bound to die, or it's an adverse outcome in the disease. Sometimes you have issues of malpractice or inappropriate behavior, but this is still, I feel, a very small proportion of the profession, who people in the profession who do things right. So a lot of things come from your own values, from what you are taught, and also from the institutional culture. So there are institutions which will be very lenient with unprofessional behavior, and some which are very strict. So that culture flows through organizations. What is acceptable, what is not acceptable. In India, it's unfortunate that we're very lenient with unprofessional behavior, and that will definitely change given the amount of anger in the profession, in the public, for the medical profession, despite working so hard. So we need to be on our toes, and somehow we need to have an internal cleansing of our own profession. So I'll go on with another similar quote, which says that the practice of medicine is an art. It's not a trade, it's not a business. And if you want to enter the profession, it's a calling in which your heart will be exercised equally with your head. If you're not worth it, do not join the profession, do something else. So one important thing to realize is that whenever you're talking about unprofessional behavior, there is an interaction between two systems. One is the personal factor of a healthcare provider, which include, and the second is the systemic factor or the work environment. So most things which happen are actually professional lapses. They are not unprofessional behavior, and things which are beyond a healthcare provider's control for different reasons. One, it could be because of the person's personal well-being. Maybe mentally he's stressed out, he's depressed, he's burnt out. So all of those things play a role. How much workload has been given on him. So those things play a role. And if you are not aware of this, it can be difficult. I remember a time when I walked into the gross room of my pathology. I'm a pathologist. And one final year student, a very sincere student, was doing something, and I saw something was wrong. So in my usual style, I said, this is a final year student, and I expect if you haven't learned until now, what are you going to do? So we tend to talk like that, I know, as teachers. And she was a very good student, and I don't know what happened. She just banged the table and she said, what can you do with me? What can you do with me? You can fail me. I can stay back for 6 more months. That's all you can do, right? And I was shocked. I was so distraught. I was so disturbed for the next, I think, whole week. I decided to stop teaching students. It was like my favorite student responded like that to me. And it was humiliating for me because she said that in front of a lot of other people. And it was months later that I realized that she was going through a lot of mental and physical abuse in her marriage. And probably I caught her at a wrong time. So people might behave in a disproportionate manner when they are going through personal crisis and you might not know. So if you notice a person in the healthcare profession who needs help, please lend an extend a helping hand and try to help that person, because a lot of us in the profession are suffering from stress and burnout and depression. And if you're in a mental state like that, you are bound to commit mistakes, are bound to be not agreeable to other people. And then there are individual characteristics which come from home, which come from your the way you've been uh, brought up, about whether you're a compassionate person, whether you're a cynical person, whether you're heartless, or not everybody's heartless, but the way you speak, all of that makes a difference. And then there are interpersonal qualities and skills. Some of them are good at communication, some of them make friends easily, some of them do not get along with colleagues. So these are all skills which make a difference to how the profession is handled. The second is systemic factors, which heads of department, deans cannot ignore. So it's one I talked about is the institutional culture. So if your culture, institutional culture is one of being charitable to patients, is going to be different. If you are a corporate hospital where the intent is making money, the way doctors or professionals are going to behave is going to be completely different. I remember a story where there is a very sincere doctor who has joined a corporate hospital, and he's struggling because the payment is done according to the number of patients you see. And this is a very caring doctor who wants to spend time talking to patients and getting their commitment, but he's in the bad books of the management because he's not able to see as many patients and earn as much uh, as the management wants. So there is a conflict between what your management wants and what you are doing. So in that situation you cannot survive. Second is, what is the training about in the curriculum on professionalism? Excuse me. So a lot of places you don't have the same values, and because values are never written anywhere, unless they're written down that this is considered professional behavior, this is considered unprofessional behavior. In the West, you will find a charter or a code of conduct for every institution. This has to be there in black and white, and everybody has to read it. I remember going abroad, and first I had to read the charter and give an online test saying that yes, I've understood what my responsibility is, where am I supposed to be confidential, what data can I tell out, what should I conceal. All of that, the little things, but people need to be aware. And when training, it starts from the undergraduate level, right? And then there are practice characteristics of how much workload you're giving to each individual, whether your team actually works properly or not. I remember there was a time when I was a house officer in surgery. I was a very junior person, and we had an emergency day. And on one, and usually the residents and the registrars, they are managing the casualty, and the senior medical officers and all, they stay at home, and you give them a phone call and they come whenever required. Ideally they should all be in the hospital, but it doesn't happen like that. So there was one particular night where in the middle we suddenly had lots of appendicitis coming in and a few trauma cases which needed to be operated immediately, and we had lesser hands. I remember one of my seniors called up the doctor at 2 a.m. and her husband picked up the phone and said she's not at home. It was a blatant lie, but we, as juniors, we could not say anything. But that kind of unprofessional behavior where you do not support your team, is not at all acceptable. So just saying that I am professional will not do. If you are at a superior position, maybe you're the unit in charge, maybe you're departmental in charge, you have to know how much workload your juniors are getting. And there the support comes of how you distribute the work. And just because one person is working well, ek gadha mila, to everybody puts every load on that person. And every institution has that kind of person. Jo kaam kar raha hai, usi ko kaam milta hai. So you have that kind of thing. So these things need to change, and delegation of responsibility and seeing how much everybody is affected, that makes a huge difference. So professionalism will come from both these factors, looking at personal factors and at systemic factors. So now how do we foster development of professionalism? So if you look at competencies, the American Council of the Graduate Medical Education has defined these 6 different competencies, where medical knowledge is on patient care is only one part. The remaining four are systems-based practice, which talks about how the system helps you to work quicker, work more efficiently, interpersonal communication, and professionalism, of course. And there's something called practice-based learning and improvement, which says every person needs to be aware of your strengths and weaknesses and work towards reducing those weaknesses by a proper action plan. In India, till recently, we didn't have it. In 2019, they introduced this line in the roles of an Indian medical graduate, which says that a medical graduate needs to be professional. Otherwise, this word professionalism was not there in the GMER. So it's very vague. It still says somebody who's committed to excellence is ethical, responsive, and accountable. So they've taken words from the definition I told you and put it in here, but it's not clarified further of what you mean by professionalism. So how do we promote professionalism? The first is to set up expectations. The second is to provide experiences. And the third is to evaluate outcomes. I'll go into these three parts one by one. The first is setting expectations, which means there has to be transparency and clarity about what is professionalism. So you need to have documents, and every institution needs to have its own document because every institution's culture is different. So what works in the West might not work for India. What works in Delhi might not work in Nagpur. So you need to have your own document talking about your code of conduct, talking about what constitutes professionalism, and a sort of handbook has to be given to every employee, not just students or not just faculty, but every employee has to know what is considered professional behavior and what is not considered professional behavior. So if you're talking about something like this, where you're talking about what is interpersonal communication, there has to be a document which says interpersonal communication means the ability to respectfully, effectively, and efficiently develop a therapeutic relationship with patients and their families. You must be able to work well with faculty, nursing, and emergency department staff, demonstrate respect for diversity and cultural, ethnic, spiritual, emotional, and age-specific differences, demonstrate effective learning skills, and provide information using verbal, non-verbal, written, and technological skills. Use feedback. Whenever somebody tells you that this is unprofessionalism, you need to be open enough to accept that kind of feedback and improve yourself. Next is ability to negotiate and resolve conflicts. We all face them in the workplace, and how you can effectively participate as a leader or as a team member in a healthcare team. So for each sub-competency, you will need to make these documents. Second is, what are the strategies to teach professionalism? So one is sensitization. So whenever a new batch of students come, you have an orientation course or a foundation course or whatever name you want to call it, where you tell them these are the qualities we're looking for in our profession. So this is what a good dentist is going to be, a good physiotherapist is going to be, or a good doctor is going to be. So that kind of, first, the knowledge or the awareness is important. Second, you provide them immersion experiences, which is when they go into the field, whether it is the community, whether it is the ward, whether it is interacting with fellow students or with faculty, how do you behave? And you can use case studies from real life, or you can use hypothetical situations or standardized patients to provide these kind of case studies, and have open discussions with students. There is no proper curriculum. You could make your own curriculum, and it's a good idea to collect these stories. When it is your own stories from your own departments, and you usually experience them and forget it. So write these stories down in an interesting fashion, and then use them as cases to initiate discussion. You could have films which show you ethical conflict or professional conflict and how things are handled. So collect all the names of Indian films or Western films which students can relate to, have these film shows, and then have open discussions on how this can be done. The last bit is provide opportunities for reflection. Reflective practice is a whole new topic in itself. Actually, each of these bits is a whole new topic in itself. So I'm just giving you an overview. Reflection is whenever you need to have journals or logbooks where you have students to write about their experiences of with patients. So this is what I experienced, this is what I did wrong, and this is what I learned from it. So when they write it, one, teach them how to write reflections in depth and what they are learning from it. That is also equally important. So if you want, I can do a separate session on reflective writing, and that will also help you. Now, having said all this, it's okay to preach about professionalism, but remember, there is something called the hidden curriculum. What you teach students in one lecture or one workshop is not going to work. Whatever you do has to be stepwise. You start from the basics and then you gradually go to the higher levels, and it has to be incremental, which means every time in the department or while teaching, when you encounter something which needs which involves professionalism, use it as a teaching opportunity and tell them that this is what you did right, this is what you could have done better. So that works there. But when I talk about the hidden curriculum, it is not just what you do in the class, what you speak in the classroom. Students are observing you when you are talking and having conversations in the corridor, when you're cracking jokes in the cafeteria, when you are chatting about cases in the parking lot, you are being observed. So what you need to worry about is, even if the students never listen to you, worry that they are always watching you, which means that each of us is a role model. If you're going to tell students to behave ethically and you yourself are not doing so, they are going to follow what you're doing rather than what you say. So this is the hidden curriculum which students imbibe even when it is not taught in the classroom. So how you speak, how you behave with each other, how dignified you are in actual practice is something. It's like Big Boss where the cameras are always on. You cannot not behave ethically or professionally. Remember that. And the last thing is, how do you assess professionalism? Now, these values that you saw are difficult to measure. So what you can do best is, but remember that if you don't have it in the assessment, they're not going to follow it. So the first thing I would advise you to decide is, what is the purpose of your assessment? If your purpose of assessment is to give feedback and improve behavior, this is going to work. If your purpose is to give marks, use it for summative assessment, be sure that people are going to fake it, because you know it. You're going to get marks, so you're at a best behavior. It might not happen that once they leave college, they're going to be at their good behavior. So if it is clarified right in the beginning that the reason we are doing assessment is to improve it, is to make you aware of where you can be better, and if that is done transparently, the reception is quite going to be better. If you're going to take punitive action, if it is punishment, I don't think you're going to get that much of cooperation all the time. So difficulties with assessing professionalism is, what is not observed cannot be assessed. And considering the number of students we have, if you want to assess and you have to, it's like if you're a fly on the wall and if you're hearing everything they say and everything and seeing everything they do, only then will you be able to perfectly assess professionalism, which is not feasible. So what is not observed cannot be assessed. And then what is to be observed has to be predetermined. So if you have your documents, if it's clear to all the teachers of what is going to be observed, then they will know what is professionalism and how they're supposed to do it. So faculty training becomes very important. I would like to emphasize this. Please distinguish between professional lapses or medical errors and unprofessional behavior. We all make mistakes. And just because you have made a mistake once, it does not make that person unprofessional for life. I would recommend that you go back and read Atul Gawande's books, where he talks about real life situation. There are several other authors like Jeremy Groupman and all that who talk about situations where people make mistakes and why there are errors. There is Atul Gawande's book called The Checklist Manifesto, which I really like, and it says the kind of little errors which happen when people operate the left side instead of the right side because of a documentation error. It's not unprofessional, it's that that system is not in place. So you need to know what is different. And always the context is relevant. Like the student I told you, everybody behaves irresponsibly or unprofessionally only when on their bad days or only when the context is not suitable to them. So avoid overgeneralizations and say that this person is completely a black sheep or what just by one situation. So always do a root cause analysis and find out what the context was. Why did the person react like that? Why did the person behave like that? It's important to go into the root cause of anything which went wrong. So there are a number of methods by which you can assess. I'll just give you a model called the combined Miller and Rest model, which says that the baseline is the student has to be, you have to test the student for knowledge. Does he know what is professional and unprofessional? So you can give them scenarios and ask them, did the student behave professionally? Did the doctor behave professionally? And that kind of awareness situation of knowing what is wrong. Did the person take consent or not? And then ask him to reason out, why is this unprofessional? So these two discussions will help a lot in opening up their minds and knowing what is wrong. Second is in an artificial situation, give them a hypothetical situation, an OSCE or maybe a standardized patient, and see how he behaves. Maybe if there is an aggressive patient, how does the patient respond? How does the doctor respond or the healthcare professional respond? Or if he's given a bribe by a medical representative, how does he respond to it? So that kind of decision making can be tested here. And then there is actual workplace situation where people working with the student or the resident can give you information about how actually they work. I will not go into different methods used to assess, but one particular thing is a multi-source feedback where you obtain feedback from all the peers, supervisors, subordinates, ancillary staff, and the patients. So if in a ward you have a resident working, you will get feedback from everybody he has worked with, including the patients. Now, important here is this is supposed to be a transparent procedure. So everybody needs to know what is being done. So you have properly designed feedback forms, and people have to be told that feedback is taken for the case of for the purpose of improvement and not for marking, and please give your honest opinion. So you will have all kinds of opinions. Some people are very rude, some people are very nice goody. So all these confidential forms reach one faculty member. The faculty member goes through all the feedback forms for that particular person, and if there are very rude comments or unacceptable comments, he tempers them so that the faculty member will make it more moderate. Then the faculty member sits down with the student and gives them the feedback in a more mild, receptible form. Okay, so the reception, if a student is not willing to receive feedback, there is no point in giving it to him. So it's given in a more acceptable form, and then deciding that this is what you are weak at, and this is what you will do in the next few months, and come back to us and let us know how it is working. So this is to be done in a very transparent form. Sometimes peers write all good things. If you ask students to ask their friends to write, they all write good things. But even if you tell them it's for improvement, probably they will write the correct things. When you ask nurses to give you feedback, wherever there's a hierarchy involved, they might not give you the actual feedback. So here you need to be a little careful. I have written a word called symmetry here. Whenever you take feedback for students, the first question which comes back is, are faculty also being assessed for professionalism? And it's a very valid question. So when you want to assess students for professionalism, be open to all the faculty being assessed for professionalism. A good institutional will do a professionalism a feedback profile for every employee. However, do not take punitive action based on that, and give them back the feedback for improvement. So feedback is important, but again, as I said, don't overgeneralize and label a person as a black sheep with a single episode, and don't assume that if people behave badly in one situation, they'll behave badly in all situations. Know what the background is. There are some tools called the professionalism mini evaluation exercise. You can go and look at this article in Academic Medicine 2006. So this is a tool which they have devised, and they have actually done a workshop and identified 142 observable behaviors on doctor-patient relationship skills, reflective skills, time management, and interprofessional relationships. So these forms work for individual institutions. So for your institution, you will have to create your own form like this. Now, having said this, if I go and ask any of you, do you want to be an honest professional or a dishonest professional? Every person is going to say, yes, I am honest. I have my integrity intact. However, professional challenges are rarely simple choices between right and wrong. You will have to make choices between two equally worthy values. I'll give you an example. Suppose you have seen a senior misbehaving with a patient. You are a junior person and you have seen something wrong happening. It needs to be reported, but will you have the guts to report it? You have to balance between the patient's choice, the patient's respect, and your respect for the teacher. So sometimes you need to report it when something is really, really bad. So, or if you, as for a simple thing, if you've seen one of your friends coming drunk to work, you want to protect your friend or you want to protect the patient. So these are choices which are difficult to make, and you need to have wisdom to know how to react when values conflict with each other. So professionalism is not an easy thing to do because the situations that you get into are very tough. So I'd like to end with Martin Luther King Jr.'s quotation that the ultimate measure of a man or a woman is not when he or she stands in moments of comfort or convenience, but where he or she stands at the times of challenge and controversy. Professionalism is always tested at a time of a crisis. How you behave at that time shows what moral fiber you're made of, and what kind of spine you have. Thank you very much. I'd like to end right here, and I'd like to take any questions that you have. If you have any feedback, please feel free to send it to this email ID of mine.
Thank you so much, ma'am, for a truly enlightening lecture, and you explained professionalism in such intricate details. Do we have any questions? Any participant wants to ask anything?
Anshu,
Ma'am, I wanted to ask you a question. Yeah,
can I go
can I
ahead?
just ask a question? Yeah. So, ma'am, is there any code of ethics mentioned anywhere to define professionalism?
Yes, there are most of these documents in American ABIM documents are available. There are these books that I mentioned, Stern's book. They all have different aspects of it, but that will probably be a Western code. Now you'll have to look at
Right.
it and create your own code. In India, there is not too much given here. So, but
Right,
Western,
right.
even UK, US, Australia, anything you pick up, they all have their own charters, and every institution, every hospital has its own charter. So that is something
Right.
that you need to create.
Correct. Right.
Anshu,
So, ma'am, yeah.
question, Deepika. Anshu, that multi-source feedback, isn't it same as a 360
Yes, it's the same. It's the same.
Okay.
Yeah.
I think we don't do that, but that's needed.
The problem with us is we have a hierarchy. So
Yeah.
if you ask a subordinate to give a feedback, you have to create the culture first. So make it feasible and open that everybody can give feedback to everybody else. Then it will probably work. So it will take some years for it to settle down and seep it, but you have to make it start somewhere.
Right.
Any other question?
Shinoy sir, can we conclude in that case?
Yeah. Anshu, can you just stop sharing? I need
Yeah.
to. Yeah, go ahead, Deepika. Go ahead.
Okay, so ma'am, I would just like to say that it was an absolute pleasure listening to you. It was an amazing session. Thank you so much. Some amazing insights there on reflective writing, hidden curriculum, and actually we need an internal cleansing of our profession, and some introspection is required there. So thank you once again for being an integral part of today's session. And over to you, Shinoy sir, for your closing remarks.
Thank you, Deepika, and many, many thanks, Anshu, that you consented to come on to our college platform for this talk. I have heard you many times in our medical college. I attended a webinar of yours very recently. And it's a treat to listen to you
Thank
speak.
you.
Such wonderful choice of words and crisp delivery. I'm a big fan, and maybe we could have that, and maybe we could definitely have that talk on reflective writing.
Yeah,
Uh,
so reflections, assessment, and professionalism, they're all um, big topics in themselves. So I didn't want to put everything into 1 hour. So you can do each of them. Teaching, it can be one topic, reflections in another topic. Um, and this is,
okay.
yeah. Oh, this is
So,
interesting.
yeah, this is on behalf of the Dean, Dr. Usha Radke, Dr. Kubde, who is my colleague, and myself. We take great privilege in presenting you this certificate
Thank you.
and, for your wonderful webinar. And Deepika, this is for you.
Thank
Thank
you.
you so much.
Thank you.
And we'll definitely, somebody's clapping. Was it you, Deepika?
I was clapping for ma'am.
I'm sure she needs a lot of it. One before we all sign out, you will be sent a feedback form, a Google form. Kindly complete that, and you will be present. You will be awarded certificates of attendance. And Anshu, I'll mail you this certificate
Right,
ASAP.
and please mail me the feedback as well. Yeah.
I will.
So, yeah,
Definitely.
yeah.
Thank you so much.
Thank you.
Thank you, ma'am.
Thank you.
Thank you, sir.
Bye bye. Stay safe.
Bye. Bye, everyone.
We have another session coming up. I think by the PhD cell right now. Thank you.